what is asthma?
So asthma is a disease of the bronchial tubes, and we have two problems.
Now, the bronchial tube's inside the lungs.
Yes, yes, sir. And we have two problems, and let's just look at what a normal bronchial tube looks like first. So here's our normal bronchial tube, and most of us probably think of that as just like pipes that are always the same size, the same diameter that we can breathe in and out. But for folks who have asthma, and for all of us, we have muscles that wrap around our bronchial tubes. And for folks who have asthma, if they're exposed to a trigger, those muscles can contract. So they can make the bronchial tubes smaller.
So they squeeze down on the bronchial tube, making it hard for the air to come in and come out?
That's exactly it.
What's the patient feel like when that's happening?
The patient feels short of breath. In extreme cases, they'll say, I feel like I'm breathing through a straw.
Oh,
yeah.
That must be very frightening to
Yes,
people.
Absolutely. This is what we would commonly describe as an asthma attack. The medical terms would be bronchoconstriction or bronchospasm.
And are there things that we can do to relieve that?
Yes, yes.
So asthma is a condition where there's bronchospasm that
Yes,
makes people wheeze and have shortness of breath, cough,
Yes.
tight feeling in the chest.
Yes.
What's going on inside those airways?
And so the second problem with asthma is inflammation. So imagine when you have a cold, think about how your nose feels. It's red, it's swollen, there's a lot of mucus, and it just makes it hard to get air in and out.
Yeah, but those good stuff you can't, but there's nothing worse than that feeling.
Exactly, exactly. And so the same thing can happen in the bronchial tubes. And so let's think about what a normal airway looks like first. It's got a nice thin lining. It's not red, there's not a lot of mucus.
So the air comes in and out, that's normal.
That's right, that's the normal side. But on the asthma side, most asthma patients have, to a varying degree, chronic inflammation. And so that means that the mucous membranes, which is the lining of the bronchial tube, is swollen to some degree all the time.
So it means there's difficulty all the time, but in addition, you can have spasm that even makes it worse. That's an asthma attack.
Exactly, exactly. When you combine these two problems, and imagine that there's that mucus in there, this patient only has a small amount to breathe through compared to this side, and then those muscles tighten down. Now you've got a very uncomfortable patient.